Hello, human beings. Today we are going to briefly go through what you might need to know before you have an appointment for your English-speaking people, ENT, ear, nose, throat specialist. For the other rest of the world, otorinolaryngologos, yeah? Because we can handle Greek. Yay! Alright, so, okay, first thing, hopefully you will find a doctor in your area. Depending on where you live, this can actually be really challenging. Ideally, you want to find someone who specializes in voice. If your concern is a vocal concern, if you are worried about your ears, find one who specializes in ears. If you're worried about your nose, find someone who specializes in the nose. Because as much as otorinolaryngologist is a beautiful umbrella, they do subspecialize. So, and they're not shy about it. They're happy about it. They know a lot about one area, so they'll tell you. My recommendation would be to either, once you've found someone, call their office or email them. And obviously, I mean, you can ask them if they specialize in the thing that you're interested in, whatever. But ask them what the examination will entail and what kind of equipment they have. So does their office have an endoscopy device? Does it have stroboscopy? Unless you live in a capital city, you'd be surprised how many places don't have stroboscopy. Most places, to be honest. And even if you're in a capital city, like London, for example, again, you might be surprised how many people can't give you a stroboscopic examination. So ask beforehand, ask before you book. Also ask them if you can obtain an image or a video of your vocal folds / the examination so that you have some medical information that is very useful to be in possession of. And if the answer to that is also yes, should you bring a USB or an external hard drive? Like, how are they gonna give you the video? That. Now, you book the appointment, you're happy, you arrive. You probably, maybe, depending on the country again, fill out some paperwork. If you're in the Balkans, you might not fill out any paperwork. Hi, I'm living in Croatia. It's nice here. Ideally, the doctor should examine your ears, nose, and throat. Ideally. They might not. So, we're talking, for lack of a better way to phrase it, we're talking like best practice, stereotypical, like these are the checkpoints you're supposed to go through and everyone is supposed to go through them. A lot of doctors don't go through the entire checklist and checkpoints that they should. And this is not a criticism on doctors. They see a lot of people, they're busy, they're fatigued. It's normal. It's normal to have a shorter protocol or working protocol that you feel is really functional. But if you have any concerns, so let's say if you have a voice problem, but you're also worried about allergies or the state of your nasal passage, or you're worried about your ears, make sure to mention this, just in case they don't look in the area because they're trying to address your major concern. So just bring your concerns to the table and voice them. Communicate with your doctors. Who would have thought? The initial examination of your ears, your nose, maybe even your oral cavity is fairly benign and non-eventful. You shouldn't really feel anything. They're just looking with magnifying glasses. Now, if they're going to scope you, they will either use a flexible scope or a rigid one. The flexible scope is usually the nasendoscopy that goes up one nostril all the way through your nasal passage, to back of your pharynx, dips down just slightly and looks at the vocal folds, and depending on whatever is going on, might move a little bit closer or further away, but it won't really be in contact with any tissue. Unless you have a little bit of bad luck and something gets knocked slightly, in which case you'll be like, heh. But that. So whether they're moving closer or further away, like you will feel movement in your nose, but nothing, they won't be touching anything, so you'll be fairly okay. If it's a rigid scope, that goes mouth, huh? And that's where your gag reflex can be like, woohoo, party, no. So, if they give you a rigid scope, it is very likely that they will hold your tongue out with gauze or a glove, whatever, or both usually, but yeah. And then they place it there. A rigid scope gives you the best quality image of the vocal folds. That's why someone would do it. Like, you just can't beat the quality that you get. So you can see the vocal folds really well. So if they want to see them really well, they'll do that. Now, because of the gag reflex, doctors do try to avoid the rigid scope, usually. It might be the only option that they have, or they might need to get a really clear image that is high quality. My recommendation would be double check if you're not certain. Like, see if you can easily drop your jaw down and place the tip of your tongue to the roof of your mouth. Do you have that level of flexibility? You're basically just trying to figure out, is there any tongue tie? Is there any way in which the tongue is a little bit shorter than average or whatever? Any reason why you might need to talk to the doctor and have them look at your tongue beforehand, because you might not want them to extend your tongue as much as the average human being's tongue might be able to extend. So it's just a comfort thing for you. And if you're not sure, just ask the doctor before they grab your tongue and do anything. Just be like, hey, I was wondering about this. It's fine. Now for the endoscope through the nose, for the nasendoscopy, this is how they can assess function. So you can see the movement of the vocal folds better. You can't see the vocal folds as clearly as you can with a rigid scope, which is just a beautiful image. But you can see the movement, so the function. They are likely to administer an anesthetic. You can choose, theoretically, whether you want the anesthetic or not. For example, I find that the anesthetic is miserable, it makes my life horrible, and it does nothing. Woohoo! If, however, you know that you're the kind of person who gets really stressed out and you overthink things and you feel like the anesthetic would psychologically help you a lot, absolutely go for it. My goodness, the hell. But just know it's really not necessary. The procedure is fairly comfortable, because you can be unlucky in life, yeah? And we need to acknowledge that these people exist and that their experience is real. But for most people, this is a fairly easy procedure to undergo. Ideally, your doctor should pick which nostril they're going to go up and into. Usually we do this through a sniff test, so we get you to close one nostril, sniff on one side, sniff on the other, and we listen out for whether there's no we. They listen out for whether one side is more open than the other side. If they are not certain, you can ask them to please check both sides, so they can put the beginning of the camera just up one nostril look around briefly and look around the other one. If you're like most humans, there won't be a very big difference. If you are like me, one nostril will be absolutely impossible to enter, and the doctor will be like, oh my god, what is up with your deviated septum? Would you like to, can you breathe? Can you even breathe through that nostril? And you're like, it's for decoration, thank you. But yeah, so I only have one side that's particularly functional, and I really wouldn't like it if someone tried to go up the other side. But even then, if you've never had a nasendoscopy before, and let's say they look at one nostril and they're like, oh, that looks pretty narrow, and then they look at the other one and they're like, oh, this one is also narrow, that already gives you feedback. And you're like, oh, okay. So they expected one to be wider. So if you experience a little bit of mild discomfort, that might be part of it. So they will go through your nose. This is the most uncomfortable part, and the part that is, this is the part that feels strange, because I would argue that most people don't have a particularly robust understanding of how far back one can go into their nose before we get to larynx. My advice for this stage of the process is breathe through your nose. They're going through the nose, so you want the nose and the nostril to be as open as you can. So don't clamp down and breathe through your mouth. Breathe them in. Open the area that they're going into, not the other way around. Don't make your life harder. And really focus on your breathing. Breathe through it. That, of course, remember, they're going through your nose. Your mouth is completely free. You can verbally communicate your needs at any given moment. You can say, slow down, stop. Why does that feel that way? You can do whatever it is that you want. They might ask you, / they'll probably ask you to put your head forward like a chicken and maybe even look upwards. This position helps them do the procedure faster and more easily for you. It's a comfort thing. It might feel very counterintuitive to have someone shove a device towards you and have you move towards it. Like instinctively, you might be like, don't do that. Don't make your life harder. Try to follow whatever instruction you're given by the doctor. They will give you instructions that match their preferences and the way that they move the scope. So listen to them and make sure to give feedback. Yeah, it's a two-way street. They're working with you, not against you. So once they are dangling and looking at your vocal folds, depending on the doctor, you might not see the image or you might be shown the image. Usually you're shown the image in my experience, but I have had 2 experiences where I could not see my vocal folds, which was fun. If you have a preference, state it before they go in, yeah? Because once the scope is in, you don't want your doctor touching too many things because bacteria, transfer of bacteria, yeah? They're going inside the body. So they will have one hand that is able to touch things and one hand that is not. So state your needs before the procedure starts if there's anything like that going on in the room. They will ask you to siren up and down and make any subsequent noises that they want you to make or any sound noises that have been problematic for you potentially. So they will observe the function. This can be an extremely short procedure. It's very, very common for people to say that they went to the doctor and that they looked at the vocal folds and it was like 30 seconds and then they pulled the scope out. This is largely because a lot of doctors are told that patients don't psychologically feel comfortable with the scope in, I would say if you feel comfortable, tell the doctor that you feel comfortable, and if you are worried that they might remove the scope too quickly, ask them beforehand, how long does this procedure usually take? If I feel comfortable, could we maybe do the procedure a little bit more slowly and take a little bit more time and observe more movements of the vocal folds? Because you might want more information, especially if something's going wrong. Yeah? All right, here we go. Write down everything. Before you go in, write down every question under the sun that you wanted to ask, everything that is important to you, and write down what the doctor said. Especially if you get given any diagnosis, my goodness, write down the exact words. If you're not certain, ask the doctor to write it down for you. On the spot. Like, you can just hand them your mobile phone and say, could you just write down what you said, please, so that I have it in writing. Yeah? Especially if something is going wrong with your voice and you're not going to this appointment as a maintenance appointment with your doctor, or you're not doing what singers usually, well, very often do, which is you book your first appointment when your vocal folds are healthy so that you can obtain a video of your vocal folds when they are healthy. So if anything were to happen, you can show the doctor what they looked like when they were functioning well and when they were healthy, which is very useful for the doctor. If you're able to do that financially, absolutely do it. It's really cool. It's a lovely experience. And it also means that you get an experience with the doctor before anything goes wrong and you're stressed out of your mind. But assuming that something has gone wrong and you are stressed out of your mind, you won't remember everything that you wanted to say or ask. And you certainly won't remember everything that the doctor said. So write down things. And the last thing is, there is a difference between observation and diagnosis. If, for example, you're getting scoped and the doctor observes that one arytenoid is asymmetrical in relation to the other, yeah? So there's a bit of wonkiness around your arytenoids. This might just be an observation. It might just be the equivalent thing of someone looking at me living life and saying, oh, you're left-handed. It's just an observation. There's nothing wrong. It's not medically significant, or it's not necessarily contributing to the problem. So it might not be a diagnosis. In most doctors' minds, because they know their stuff really well, it's very clear to them that something is an observation and that something else is a diagnosis. It might not be clear to you, and it might not feel clear. So it might be worth asking and just double checking and saying, either the usual, is that bad? Is there something wrong with that? Or saying, is that an observation or a diagnosis? Even when they give you a diagnosis, you can even just confirm and say, so is this really, is this a medical diagnosis, or is this just what was observed? It's worth knowing, yeah? Because we can get really stressed and worried about observable things in the body that are not abnormal and are not significant. This is one of the primary reasons why doctors don't send you for random health checks. Because statistically speaking, they will find something, but that something that they found was never creating a problem in the first place. So addressing it could cause more harm and might not be worth it. A little detail about injuries and doctors, just to bear in mind. Injuries happen. And they don't mean that you're bad or that you did anything wrong necessarily. I mean, you might have done something wrong, but they just happen. They're part of life. They can feel life-changing. If you're very unlucky, they can be life-changing, and they can be extremely stressful. Doctors exist to help. They're there to help you. What I would like you to consider in the context of a voice injury is, I would like you to think that the ENT specialist / laryngologist is like the number one priority, and the number one concern is to confirm whether or not you have cancer, regardless of your voice injury and regardless of what has happened. As in, you could be saying, oh, like my voice changed in X, Y, and Z ways, and I think it could be that, but the number one priority is always going to be excluding cancer as a diagnosis. As someone who can work with singers to help after your surgery voice therapy and can help with singing rehabilitation, if a doctor has excluded cancer, this is the major thing that I want. They have done their job. Everything else, more or less, we can work with. But I need to know, we need to know that cancer is not the issue. If a doctor looks at your vocal folds and is like, everything looks great, there's nothing there, and either says that you have acid reflux or muscle tension dysphonia, or that you just have a psychological problem, that might feel really annoying, and it might feel like the issue has not been addressed at all. But the exclusion of cancer is the most important task. So even if they didn't give you exactly what you wanted, they did the most important task. So this is just a little bit of a shift in your expectations going in, because I sometimes find that people go in to an appointment with a laryngologist thinking that this person is a voice therapist or a rehabilitation specialist. So thinking that this person is going to tell them exactly what's wrong with their voice, what they need to do, and yada, yada, yada. A laryngologist is a medical professional. They are most concerned about disorders in the voice, any growths, any lumps, bumps that are not benign, that are aggressive, and things like papilloma. Yeah. These are their major concerns and their major areas of specialization. And that's why we go to them. We need to exclude the worst case scenario. Because if you have cancer, bubbling around in water and feeling a little bit better psychologically for a few minutes is not what should be happening in terms of treatment. So just go in with medical expectations and go in expecting this person is looking for cancer or absence of cancer, and everything else we find is a little bit secondary on the hierarchy of concern. And excluding that possibility is of utmost importance. I hope that you only have lovely experiences with ENTs. I hope that your appointments are nice, not stressful. Bring a loved one with you. Or a friend, doesn't matter. Just bring someone along if you're really worried about it. If you don't like your laryngologist, please find another one. If you're worried and you're like, who the hell do I go to? Reach out to a voice teacher or an association, and like find the laryngology association near you. Whatever. Just reach out, be like, hey, I'm in this area. Is there anyone you'd recommend? Phone calls can really help. You'd be surprised how much of a vibe you can pick up from a simple phone call or even a simple email communication about how nice people are, even if it's just the secretary of the doctor. You'd be surprised. So advocate for yourself, advocate for your health. If you have any questions, write them in the comments.
Join my Patreon.
And that's everything. Bye.